Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Minister Ntunwoka. First, some of the highlights. Today, mysterious deaths in Kano now unraveled as PTF attributes deaths to COVID-19. As lockdown measures start to ease, our focus is how to maintain social distancing and slow down the COVID-19 infection rate. And Italy, the first country in the world to order a nationwide lockdown, relaxes restrictions as number of deaths drop. The nation is experiencing another phase in the coronavirus pandemic with the relaxation of the lockdown order. The streets were thrown open today with the usual hustle and bustle known in the Lagos metropolis. Although there are fears that the gains of the lockdown may turn sour if the COVID-19 hygiene protocols are not adhered to and enforced. This is coming as the presidential task force over the weekend revealed that the unexplained deaths in Kano was indeed as a result of COVID-19, and the handling of the burials there may be a need for massive contact tracing. On our theme today, we discussed the lockdown relaxation and maintaining the gains achieved thus far in the fight to contain the coronavirus. The Nigeria Center for Disease Control, NCDC, confirms that the number of COVID-19 cases in Nigeria has risen to 2,558 following the announcement of 170 new cases at midnight. According to the center, 400 patients have been discharged and a total of 87 deaths recorded. Of the new cases, Lagos has 39, Kano 29, Ogun 24, Bauchi 18, Kaduna 15, Abuja and Sokoto 12 each, Katsina 8, Borno 7, Nasarawa 3, Adamawa 2, Oyo State 1. Currently, Lagos has the highest infections in the southwest and the entire country, with a total of 1,107 cases, followed by Kano, which has the highest in the northwest, with 342 cases. The Federal Capital Territory has 278 cases. Borno has the highest figure in the northeast, with 82, while Edo leads the state in the south-south with 52 cases. Enugu leads the southeast with 8 cases. Taraba also has 8 cases, having the highest figure in the north-central region. There also seems to be more insight into the unexplained deaths in Kano State. The leader of the Presidential Task Force Committee, Mr. Nasiru Gwazo, has attributed the mysterious deaths recorded in the state to COVID-19. The team was in Kano over the weekend to join in receiving the mobile testing facilities donated by Africa's businessman Alhaji Aliko Dangote to the Kano state government. The Dangote Group is setting up a 400-a-day testing capacity in the state, which has been accredited by the Nigeria Center for Disease Control. We have similar laboratory, which has also been set up in Lagos and Ogun states. In Edo State, the coordinator of the internally displaced camp at Uogwa in the suburb of Benin City, the state capital, Mr. Solomon Folorunsho, wants government and other relevant agencies to assist the center to sail through the coronavirus pandemic unscathed. He disclosed this to Channels Television in an exclusive interview at the camp on how the center is coping this period.
They have been informed, and we do daily sensitization. We keep informing them, we give them reports that we are getting from television, newspapers, and social media. So everybody is well informed. The issue of social distancing, in fact, we do daily education, daily information, but because of the population and the accommodation we have here is not enough to make them space out. We don't have those materials needed like sanitizer, soaps, hand gloves, face masks to wear. So we want to appeal to relevant agencies to please supply us with those things and also help us create an isolation center here.
And in Abuja, there are reports of traffic build-ups in Kubwa Expressway, Garki area and Asokoro roundabout. And this is mounting fears of COVID-19 following lockdown relaxation. The situation is similarly the same in some parts of Lagos. Early today, Ogba area, there's been huge traffic from Iju Road to College Road and up to the roundabout where you have Excellence Hotel. It's also the same situation in Ogudu area of Lagos State. Meanwhile, according to the guidelines released by the federal government, which begins today, for the first phase of the lockdown relaxation, every citizen is expected to wear the face mask or face prosecution. Also today, a curfew will be in place across the country from 8 p.m. to 6 a.m. daily in line with the president's directive. There will also be mandatory provision of hand-washing facilities, sanitizers in all public places, a ban on interstate movement except for essential travels and services, no gathering of more than 20 people outside of a workplace. Others are controlled access to markets and locations of economic activity, mandatory temperature checks to be conducted in public spaces, physical distancing of 2 meters to be maintained between people in workplaces and other public spaces. In the meantime, states across Nigeria continue to adopt varying measures to curbing COVID-19. Let's begin with an update in Katsina State, where the government has directed the shutdown of 3 more major weekly markets in the state. The affected markets are Garkin Daura, Dutsi, and Kayawa. The directive is coming following growing concerns by the government and other stakeholders over the increase of confirmed COVID-19 cases in the state. The secretary to the state government, Alhaji Mustafa Inuwa, says the shutdown order starts with immediate effect. Elsewhere in Adamawa State, the governor, Umaru Fintiri, has relaxed a 14-day lockdown earlier imposed in the state, which began on the 25th of April 2020. The governor in a statewide broadcast said the decision became necessary after due consultations with stakeholders to ease the lockdown. According to the government, it is in line with some of the measures taken by the federal government, particularly those that are in consonance with the peculiar situation in Adamawa State. And the Taraba State's Technical Committee on COVID-19 discharged a total of 122 persons quarantined at the state's NYC orientation camp in Sibre Adokola, local government area of the state. Chairman of the State Technical Committee on COVID-19 and Commissioner for Health, Dr. Innocent Vakai, while handing over 124 people to the 7 local government councils, caretaker chairman in the state said they all tested negative twice. He said about 130 people were intercepted at the Taraba borders and quarantined because they came from high-risk states such as Kano, Bauchi, Jigawa, Ogun, and Lagos. And to Borno State, where the Deputy Governor, Umar Usman Kadafa, has lamented that some citizens in the state doubt the existence of COVID-19 in the same manner Boko Haram was initially underrated. Mr. Kadafa, who is the chairman of the state's high-powered response team for the prevention and control of COVID-19 pandemic, while responding to newsmen, said that this is in reaction to a viral social media video that surfaced Saturday, where hundreds of sympathizers were seen attending a burial in Maiduguri without regards to the social distance protocols. And finally, over 80 travelers on the Lafia-Makodi interstate borders have been denied entry into Benue State, including a truck which concealed 10 Almajiri children from Lafayette and 9 other vehicles, all heading for Makati, the state capital. The measure, according to the Benue State Deputy Governor, is to prevent unnecessary and non-essential travelers migrating from high-risk destinations, particularly those fleeing from Kano and other parts of the far north. Well, joining us for more on flattening the curve of COVID-19 is Dr. Anire Chima Oduko, a public health physician. She joins us via Skype. Thank you for joining us on the program. I must begin by asking she joins us via telephone. Thank you again. I must begin by asking seeing the lockdown measures are beginning to be relaxed at this point in Nigeria. Some say that the hunger virus is more potent killer than coronavirus. What are the strategies you think we can use to eliminating that mindset to begin with?
I think people are not really aware of the danger coronavirus poses to us as a nation, and that is why they are really agitating release of the lockdown measures. So it's still reorientation. I was going through some chats on my phone and discussing with some colleagues, and they were saying that if, the others or the religious leaders were really involved in this and maybe they said, do not leave, don't come out in Ikorodu because something is happening, people will comply. So I think we also need to use a lot of religious leaders, community heads, people that our respect and can relate to tell them how serious this is and to convince them that, well, we know that hunger is also a problem. We need to make these sacrifices for the good of the nation. So I think these are some of the measures we can employ, talking to religious leaders, community heads, people that the people fear and can respect a lot. That can help and go a long way.
Okay, perhaps another thing as well is the mindset. So social distancing or physical distancing, how do you think people can stay positive, boosting their productivity as businesses reopen?
Okay. People just need to, it's a mindset thing, like you said. They need to just decide to be happy with the situation and make the best out of it. And know that it's just for a season, it's just for a time. And I think that's just convince themselves to comply with the directive.
How important is social distancing, especially for companies and people, especially transportation as well? Should there be as much compliance as possible as a healthcare physician, seeing that, we're also trying to stop the spread of the pandemic? How much enforcement do you expect we will see this period?
Okay, I would really like to see our security personnel enforce the measures that have been given by the Lagos State government. The measures given by I'm in Lagos, so the measures given by the Lagos State government is actually very good if it is enforced. But one of the problems I foresee happening is people not taking this in serious. I went to the mall to shop, like a supermarket near my house. And yes, they had a directive of you have to come in with a face mask and, of course, use a hand sanitizer. But people would use the face mask and not cover them. They just put it around their head as for fashion without actually using it, showing that people don't still understand why they are using the face mask. So I think it's not, yes, we should, all the directives that have been given by the government is very good, but we should really ensure that they are enforced.
All right, we appreciate your time, public health physician.
Enforcement.
Okay, all right. Thank you so much, Dr. Anire Chima Oduko. Thank you for joining us on the program. So essentially, it's not a fashion statement. We have more on the COVID-19 pandemic update, especially with Cross River State preparing for life after the pandemic. Please join us again. Welcome back. The Cross River State Governor, Professor Ben Ayade, has indicated that the state will go ahead with its agro-industrialization drive in the midst of the virus outbreak. This is to enable them curtail the attendant food shortage expected to hallmark the post-coronavirus pandemic. Speaking in Calabar, the Cross River State capital, it was deploying the newly acquired tractors and other farming to the field. The governor explained that his administration is determined to make the state self-sufficient in food production.
Equipment, they are moving to some of the farms in the northern senatorial district of the state. And the idea is that Cross River State is already looking at the post-COVID-19 era, when we are done with it. Now that the oil prices come to zero, come below the cost price, it is obvious that Nigeria will have to move to agro-dollar. So we are moving from petrodollar to agro-dollar, and Cross River is leading that process. In each senatorial district, we have a certain amount of work to be done. In Obubra, we have the industrial park and we have the agricultural agro-industrial zone. In Obudu, we have an industrial park. In Ogoja, we have, and here in Calabar, where I'm standing, we have one. And in Akankpa and Bakassi, including Odupani, where we're doing export banana, which we're going back to that factory very strongly. I think Nigeria will watch out and see how Cross River State will focus on agriculture and migrate this country from petrodollar dependence into agro-dollar generation.
All right, now, Dr. Tosin Taiwo, GP Registrar, Queen Elizabeth Hospital, Kings Lynn, joins us via Skype. Thank you for joining us at this time, Dr. Tosin. What's your observation and assessment of the lockdown measures in the UK? Would you say that it is time to relax the measures?
Thank you for having me. With the things presently, we are working to look at how we can do that. It's probably going to take another 3 to 4 weeks before we get there, but we do need to start relaxing measures for people to start getting out and start getting back into the activities that we know. Like we all know, we are about 3 weeks behind Italy, and Italy has started relaxing their measures. But there is an exit strategy that the Prime Minister is going to broadcast probably next Sunday that will lead the way to this.
What do you think about Nigeria's measures, seeing as we started relaxing our lockdown for, some major key cities?
Yes, with Nigeria, some of us honestly feel it's a bit too soon, but given the situation back home with a lot of people crying with terms like hunger virus, it's something that has to be done. But with the good news on the horizon, with the discovery of probably a new drug that has shown promise, that may be a key issue for Nigeria.
Tell us, we understand UK scientists developed a new coronavirus antibody test. They're saying it produces results in 35 minutes and it's 99.8% in terms of accuracy. How important is this in the fight against COVID-19?
That's a key step. It's an antibody test developed by, I believe it's Roche Diagnostics, and they said that the specificity for the test is 99.8% and sensitivity is about 100%. What that kind of tells us is that it can accurately tell us who's got the infection and who hasn't. So it's quite good. If we can roll that test out, we can get a lot of people tested, and with that, you know who's not infected, who has been infected, and who is presently infected.
Looking at the global fears that we might live with this virus for some time, how easy do you think it will be to changing one's lifestyle?
That's a good question. It's quite unpredictable. I think the CDC, if I'm correct, has said that it may be with us for at least 2 years. So we will experience a surge. Lifestyle-wise, I can't really predict as to how that would turn out. Obviously, there's going to be the new norm of people wearing face masks, which I probably think will probably be the new fashion accessory that everybody has. But social distancing in place, we will have to modify it. Taking the airline industry, for instance, they're putting things in place to go with that. But it is very unpredictable to see how it will turn out.
Let's get your point of view. We hear the UK is experiencing problems with expanding testing to about 100,000 tests per day. Why does there appear to be a problem so far?
Yeah, with the testing, the way it's going so far, they are getting 100,000 tests, but the catch there's one thing to test people, but getting the test you've done to the lab to analyze it. Remember, this is not the rapid antibody test that we are doing. It's still the nasal swab that they are sending. So the tests have to be taken and taken to the lab. So although they may take 100,000 tests in a day, they probably will not get that same amount of processed. The figures that we have say that, I think as of yesterday, they did get up to over 100,000 people tested, but the results that will come out may not be that fast. So that's probably why. There was an issue with capacity, but I believe they are on top of that now.
From the Nigeria Center for Disease Control, the DG said since the onset of COVID-19, we're committed to following the science, and the clinical trial of remdesivir seemed to be showing promise, saying the next step is to make the drug available. What are your thoughts on that drug?
Yeah, the trial that is conducted in Chicago, it's actually done by a colleague and cousin of mine. He has produced the thing and was published. I think he talked on CNN about the promising trials that they've done. They've had good results. I think the key thing now is how Nigeria goes about acquiring the drug and making it affordable to the public, because it will probably still be under patent. That might be a bit difficult for Nigeria.
But then you're saying it's an important step.
Pardon, sorry?
You're saying that it is an important step.
It is an important step, most definitely, but it's how we roll it out to the grassroots public to give everybody the drug if they need it.
Talk to us about the efforts, your thoughts about the efforts, because we have several state governments that are taking different measures with regards to curbing the coronavirus pandemic. I'm sure you've heard about what's happening in Kano. At some points, they talked about unexplained deaths, but now those deaths have been attributed to COVID-19.
Yes, from what I can see, in Kano State, there was a bit of a backlog in people catching up with the idea that social distancing and testing was necessary. With what's happening now, I initially thought Kano might be the second epicenter, which actually it is, and they've not been able to quite get on top of it as quickly as other places. What I want to know would be how the healthcare professionals are faring there, whether they do have enough capacity to manage the current situation in Kano.
Interestingly, we also have two states that appear not to have any confirmed case of COVID-19, that's Cross River and Kogi. Do you think there might actually be cases, and perhaps because we're not testing enough yet, or that they probably have, been the lucky ones?
More than likely, they do have cases. It has to do with the testing capacity. With the way they think it's a highly contagious disease, and it would have spread to every place. It's highly unlikely that they do not have any tests, any confirmed cases. They just have to probably ramp up their testing.
All right, we appreciate your time, Dr. Tosin Taiwo, GP Registrar, Queen Elizabeth Hospital, King's Inn. Thank you for joining us on the program.
Pleasure to be here.
All right, now more than 4 million people, an estimated 72% of them men, returned to their construction sites and factories as the economically and emotionally shattered country tried to get back to work. Talking about Italy, the sounds of banging, drilling echoed across Rome, and a group of men drinking espresso out of plastic cups in front of the Pantheon, the former Roman temple, as cafes reopened for takeout. Some grocery owner was set to say that we can hear some noise now, lots of excitement as indeed they relax lockdown. But we hear that bars and even ice cream parlors will remain shut. The use of public transport will be discouraged, and everyone will have to wear masks in indoor public places. Now, take responsibility. That's the message from the Nigeria Center for Disease Control in protecting your health. They say you need to practice social distancing. We all need to practice physical distancing by non-contact greetings, maintain at least 2 meters between yourself and others, stay home if you feel unwell, and call your state hotlines. The website has all the information and statistics that you need. Also, the World Health Organization's website has rolling updates on the pandemic, strategies, plans. Each moment it keeps updating the number of cases, the number of deaths, and the recovery efforts across board. You can take a closer look at some of the numbers in real time. That's our COVID-19 update on Channels Television. Thank you for watching. Another update comes your way again at 6 p.m.